Health Styles. I'm Connie Mead. Today we take a look at a group of disorders that are relatively rare, and due to the rarity of these disorders, they are often misdiagnosed in the early stages. And these diseases come under the heading of spastic paraplegia. There are two of these diseases that we'll be talking about today: hereditary spastic paraplegia and primary lateral sclerosis. And here to discuss this with me today, I'd like to welcome Kathi Geisler, a Chelmsford resident, who's here to help us in this discussion, and Dr. Joel Seidman also. Thank you both for being here, and thank you for joining me. Kathi is the Vice President of the Spastic Paraplegia Foundation, and you're a Chelmsford resident. And Dr. Seidman is a retired physician who has specialized in pulmonary medicine and critical care. Is that correct? Okay, and you live in Woburn, did I understand? Okay, well, I thank you again for being here.
Our pleasure.
Okay. Just before we get started in our discussion, I just want to mention that it's a pleasure to have Kathi here on this side of the camera. Kathi is no stranger to Health Styles because she is often filming here with us many of our segments, and she's usually behind the camera, so it's a pleasure to have her now on the dais here with me to discuss this particular disease. So I'm glad to have you here, Kathi.
Thanks, Connie.
So maybe we could start out by just getting a sense of what these disorders are, what these diseases are. As we said, that there are two of these that come under the category of spastic paraplegia. One is hereditary spastic paraplegia, and the other is primary lateral sclerosis. Can we just talk about what is going on in these disorders? I don't know if you want to start with one and then move to the other. What happens to someone who has this kind of disorder?
Well, thanks for inviting us here today. First of all, it's great to be here. These are two groups of disorders that are very rare, and most likely nobody out there really knows too much about these particular diseases. And they are manifested by symptoms of spasticity and paraplegia. So that's why we call them spastic paraplegia disorders. They are related to the more commonly known Lou Gehrig's disease, which probably a lot of people have heard about, which is a deadly and very serious disease. These diseases are benign, they are progressive, and what they cause is increasing spasticity and paraplegia, or weakness, of the muscles of the body. And there could be different parts of the body affected in both of these groups of disorders. Both of them affect the legs and cause increasing weakness and spasticity of the legs, which causes increasing difficulty walking, often leads to someone needing a cane, then perhaps a wheelchair or a walker in between. And that happens over a course of some years. Some individuals with these disorders have the same kinds of difficulty in the muscles in their arms and hands, and some of them even in their voice as well. And they have problems, increasingly problems with speaking. And many end up being very difficult to understand. So although they're not deadly diseases, they are disabling diseases. And we started the foundation, a group of patients, myself included. I have hereditary spastic paraplegia. Started this foundation 2 years ago so that we could give some sources of information and support to patients, and also help support research so we could find the cures for these diseases.
Okay, wow. So that's certainly a lot that you've taken on, certainly as you begin a foundation. But let's get to that in a little while. What I'd like to talk about, first of all, is just your experience. How old were you when you first had this happen? Shall I say had the onset of symptoms that caused you some concern?
Well, let me say first that for hereditary spastic paraplegia, there are several different versions, and some of them can actually start right off the bat from childhood. Some can start very late in life, I mean 50s and 60s. Most of the times they start in the second or third decade, or second 30s or 40s period of life. That's the most common types for this particular disorder. And for me, not sure maybe exactly how old I am, but it started several years ago when I began having trouble with my walking. I always had walked with a bit of a pigeon-toed style from day one, but we didn't know anything about this disease. We thought that I just walked pigeon-toed, like a lot of kids do, and that was all there was. But I do know now, after learning about this disease, that actually was a foreshadowing. and that later in my life I would actually have this take place.
Okay.
So problems serious enough to really manifest really started a few years ago, and they are on a progressive course, and I use a cane when I go out of the house now. I started using that a year ago. And the typical course is for somebody to progress in a slow manner over a period of time.
Okay. So now just backing up to what you were saying, when you were a child you walked pigeon-toed. That's not to say that any parent who has a child who's walking
Absolutely not.
should worry
Lots
that
of
this
kids
is
walk pigeon-toed.
Right.
And that's
okay.
why there really wasn't any extra
no
attention,
concern. Right.
because lots of kids have pigeon toes, yeah.
Right, okay. So now you mentioned that this is hereditary spastic paraplegia. Had there been any symptoms like throughout your family? Anybody in your family who had this before?
Well, we didn't know about it because, well, the short answer is yes. The longer answer is my grandmother had what they thought was multiple sclerosis.
Okay.
And so we thought she had that disease. We did not realize that this was a disease that our family had. It's very common for people to be misdiagnosed with either hereditary spastic paraplegia or primary lateral sclerosis because they're very innocuous when they start. They're very subtle when they start. There are no definitive quick tests that say you have this disease.
Okay.
In either case, it's really a process of elimination. People will look at tumors, they'll look at Lou Gehrig's disease,
Right.
they'll look at multiple sclerosis. If you're a child, they'll look at cerebral palsy. They'll look at a very large number of different things, and when everything comes up, no, 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 this is one of the few things that's left over.
I see.
So often it's a diagnosis by exclusion, excluding other things.
So it's actually helpful to have a physician here, so maybe we can ask a couple of questions too that relate to the diagnosis end of things. So as Kathy's telling us, there's no real definitive test for these diseases. But now, are there definitive tests for some of these other things like multiple sclerosis or what were the other ones? Oh, cerebral palsy. I mean, some other ways, some of those tests that you can do something specific to test for, and so when that comes back negative, you know that you can rule that one out.
Yes, there are tests of spinal fluid and X-ray tests, CT scans and MRIs that can help in the diagnosis of multiple sclerosis. Lou Gehrig's disease can be diagnosed with EMG, but there are no specific tests for PLS, primary lateral sclerosis.
What's EMG, did you say?
An electromyogram.
Oh, I
where
see,
they
okay.
stick needle electrodes into the muscle and record the nerve impulses coming down to the muscle.
I see, okay, so they can eliminate Lou Gehrig's disease by doing that test.
Yes.
I see. So it sounds like the people who go through this must have to go through some of this testing, even though there's nothing definitive that tells them this is what they have. They still go through testing to try to eliminate other things. Is that correct?
Absolutely.
Yeah. And is that an unsettling time for the person going through this? Do you want to take that one, or?
I developed my first symptoms when I was in my early 50s, and that was about 12 years ago. And it was rather insidious, as Kathy mentioned. I was on a plane coming home from a meeting, listening to music, and I found I couldn't tap my foot fast enough to keep up with the music. And that was unusual. I mentioned it to my doctor at my next annual physical, and we both shrugged our shoulders and nothing more was thought about it.
Can I ask, were you able to, afterwards, were you ever able to regain that?
No.
So after that you just were not?
That stayed.
Okay.
A few years later, I began to develop the signs of spasticity in my right leg, something called clonus, where the ankle would bounce. It didn't really interfere with anything. I was biking, playing tennis, hiking, doing all sorts of physical activity, and it didn't really bother me that much. But over a period of years, it kept getting worse, and I started tripping and falling. And I was developing weakness in the right leg. And I started going through many tests. And as a physician, we're always at risk of making self-diagnoses.
Right.
And I, at one point, thought I had ALS, something that I had always feared. And it was tough.
Because
but
you were showing the symptoms that were consistent with that as well.
Yes. But I started seeing a series of neurologists, all of whom assured me this was not ALS because I had the electromyogram, which didn't show those characteristics. But as things went on, it was obvious something was wrong. And I actually made my own diagnosis through reading, and I presented my ideas to the neurologist who confirmed them, and there were some consultants. I saw a consultant neurologist that I saw that confirmed the diagnosis.
So what is going on, and can you tell us too what is actually happening biologically or physically?
I can help.
Okay, sure. You have this chart here. Maybe this can help us. I don't know if you can get a
Yeah,
shot
this
at it.
might help a lot. These are often also called upper motor neuron diseases.
Okay.
There's a relay system to move your muscles in the body.
Okay.
There's upper motor neurons and lower motor nerves that are involved. The upper motor nerves, this is the brain, reside up here in the brain in the motor cortex. And this is part of that nerve cell that goes down and makes up the spinal cord. So all of these cells is what makes up your spinal cord. These are called upper motor nerves.
Okay.
Down in the spinal cord, at all the lengths from the brainstem all the way down, these end. And where they end, they then feed out to what's called a lower motor nerve
Okay.
that goes out to your muscle.
I see.
And so the problem with our diseases is this nerve system,
I see.
not the nerve system that goes from the spinal cord out to the muscle.
Okay.
And when there's damage in this nerve system, the result is spasticity and paraplegia, as I've been talking about. When you hear about a spinal cord injury, for example, and if that injury happens at whatever level of the spinal cord will correspond to the muscle systems that then are damaged.
Right.
So that the higher up in the spinal cord, the worse off you are.
Right.
Most of our problems are coming lower in the spinal cord where we feed out to the legs. In primary lateral sclerosis, there are problems occurring at higher lengths of the spinal cord as well.
Okay.
So that the nerves that will then feed out to the arms or then feed out to the speech, to the bulbar muscles, are then being affected. So where the problems are will determine where in the body is the problem. I might point out that spasticity and weakness are symptoms of, as I mentioned, cerebral palsy, spinal cord injury, Lou Gehrig's disease, other diseases. And anytime you see those symptoms, it's this nerve system that's being disturbed.
I see.
And because our diseases are exclusively from damage in this nerve system, our primary symptoms are spasticity and paraplegia. And diseases like MS and other things that cause problems in other areas, they're going to cause other symptoms as well. So we're pretty uniquely confined to that area. I hope that helps.
Right, right. And so do they know what causes this degeneration? Or that's what we're trying to find out
Well, we're
now?
trying to find the causes and the cures. A group of patients just a couple of years ago, we met online. We actually have a whole patient community online. And if anyone wants any information, the best thing would be to go to our website.
Okay.
We put out a pretty comprehensive one last year. It's the only one like it out there that's medically reviewed. It's the Foundation's website. It has all the information anybody could possibly want.
Right.
And what we're doing as a foundation, our primary mission area is to raise funds to support research. There are not a lot of researchers working in this particular type of nervous degeneration, but there are a good handful, and there's not a lot of public monies. So we're doing what we can to support their research. And we do know that what research our researchers are doing will be relevant to Lou Gehrig's, to Alzheimer's, to spinal cord injury, to all the other neurological diseases out there, because we know there are common threads throughout all of the neurologic diseases. So what we wanted to do with our foundation is really target that particular area to make sure that that's being looked at as well.
Okay. All right, before we get into how you started your foundation, too, I just wanted to ask you about, we talked about some of the symptoms, with spasticity certainly is one. Is there any pain involved with this for either of you?
Some.
And let me just make sure we are clear. I'm not sure we said that you had the primary lateral
I
sclerosis
have primary
as opposed to
lateral
the
sclerosis.
hereditary spastic
Yes,
paraplegic,
it's
right?
already started to affect my arms and hands, and even my speech is becoming a little bit dysarthric. It's a little bit hard for me to speak fluently.
I see. But is there pain involved at all?
Generally speaking, there's no pain. I keep telling people the only pain is when I hit the floor.
Oh, yeah.
There are some individuals who do suffer from pain from muscle spasms. I get stiff very easily, and that sometimes is uncomfortable, but I can't say it's painful.
Right.
Yeah, we do have about a third of our population have enough problems with spasticity, pain from spasticity, to say they have pain associated with the disease. And most often it's because of muscle spasm. Like anybody gets a painful one sometimes in the middle of the night.
Right.
People with these disorders might get them more frequently. Some get them every day. I've heard of some people who need to take morphine. So it can be a serious problem. I'm lucky, like Joel is, that I don't really have that experience, so I feel fortunate for that.
Okay. And so what can you do to alleviate the symptoms at this point? Is that what you do now, is just pretty much treat the symptoms of the spasticity? And so are there medications that are available to do that, to help you with that? Or
Yes,
techniques?
there are, well, one technique is exercise and stretching, just as anyone wants to avoid muscle pain
Okay.
who doesn't have any neurologic disease. There are medications that are prescribed to reduce the spasticity. There are several medicines of that sort. They all share the common side effect of making you sleepy or fatigued, in some cases even contributing to muscle weakness. So they are limited value.
I see. Because that's sort of that's one thing you probably don't want. You probably have muscle weakness as it is. You don't want
Yes.
to make that any worse.
Yes.
Right. What about things like Botox? Because don't they use that for like people with cerebral palsy for the spasticity or that they have, or no? Does that apply in this case or not?
I believe there is some experimentation with Botox, but again, these are rare diseases. There aren't a lot of us around to experiment on.
Okay.
It's been estimated that for primary lateral sclerosis, there may be 500 of us in the country with this disease. So
Wow.
it's significantly less common than Lou Gehrig's disease.
I see. So that's why we hear about that more often, probably. And do you know, have they done any kind of studies to see whether there are any populations that are more apt to be prone to these? I know you said it could hit at childhood or later.
That's a good question.
But are there ethnic similarities or gender similarities or anything like that? Or
there
geographic?
doesn't seem to be. There doesn't seem to
Okay.
be. What we hear from the researchers is there's nothing that they notice. That it's just like anything else, I guess, bad luck of the draw, and that there doesn't seem to be something there. They do, of course, question if there might be some environmental concerns. They do question if someone has exasperating, stressful situation, it might bring on something earlier or more severely. They would probably need to be prone to get one of these diseases anyway, and in the hereditary case, you'd need to have the gene. But they do think there may be circumstances that can start something earlier or make it more difficult and challenging.
Okay, so you really can't generalize in that way. But you say, too, now it is progressive. Is there at any point it will level off and just, kind of, you'll be in sort of a holding pattern? Or
It probably,
does it just continue?
It probably appears to level off because if you make a progression to the point of requiring a wheelchair, and you're in the chair, there's no place else to go because that's that's about as far as you can go. So it may not feel that you're progressing a lot more at that point because you've progressed to such a degree that you're seriously impaired.
Right.
The general thought is that it's a very slowly progressive disorder, and once it's onset, it just continues a very slow progressive course over a period of time. As Joel indicated, he's now showing some symptoms in his upper body, and yet he's had problems with his legs for some years. Right, Joel?
Right, right. Now, we noticed, too, we brought your wheelchair up here, too. I don't know if we can get a shot of that, because this is kind of an interesting wheelchair in that it helps you exercise as well when you're just trying to get around. Would you say that that's a fair statement?
Yes, this wheelchair, I can pedal.
Okay.
So I can propel myself, and legs are much stronger than arms. So
Right.
a manual wheelchair is tough, especially at my age. I'm not a wheelchair marathoner,
Okay.
but my legs are still pretty strong.
Okay.
So they're spastic, which makes walking very difficult. But once I'm in the chair, I can push pretty hard on the pedals. So I can move along at a good walking clip with this, and I can steer it so that hills and slopes are not really as much of a problem as a manual wheelchair.
What about slowing it down? Or is
It
there
has
some sort
brakes.
Okay. Yeah. All right. So is that something that I guess you just kind of experiment to see what would work for you as a patient to see?
Yes, I was fortunate enough to run into this at a trade show, the Abilities Expo in Boston, about 2.5 years ago. And I saw this, tried it out, and I said, that's for me. I
Okay.
enjoyed bicycling and walking, and this enabled me to get out on the bike trails again. Slowly, but I can get out on the bike trails and take walks with my wife.
Oh, that's great. So, wow, even on the trails with that, that's good. So it's kind of heavy duty as well.
Yes, and it's great indoors as well. We spent yesterday at the Museum of Fine Arts in Boston, and it's very easy to get around, several hours of museum gazing.
Okay. All right. Well, that's good. It kind of shows us a different approach to things, which is good. I know that time is moving along, but I want to hear a little bit more about the foundation you started. You said it was done through an online community of people who have these disorders. To begin a foundation is a pretty daunting task, I would imagine, where none exists. How did you go about doing this? Do you want to tell us about that, Kathi?
Well, it's really, I think, a very interesting story of the power of what can happen. About 7 or 8 years ago or so, my sister put up a website for my disease because she wanted to learn more about it. And she went online, and there was no information. And she's a computer programmer by profession. And she had an opportunity to learn how to do web pages, and she decided this would be a good topic. So she put one together and pulled whatever she could find, which at that time was very little, on a website. And she began to get inundated with emails because other people were going online looking for information. And we started an email support group. So we had people joining us from across the country, from other countries, all around the world, who wanted to learn more information. About 1999, the same experience was happening in the primary lateral sclerosis community. And someone started a website, someone started an email group. The person who started an email group formerly lived in Andover and had, at that time, a diagnosis of primary lateral sclerosis. Now they're a little uncertain that he may have hereditary spastic paraplegia. There's a lot of crossover diagnosis between these. But he approached me. I started to do conferences here a few years ago just as a person wanting to bring people together. And he came to one and he said, we really should think about forming a foundation because our online communities have grown. We've met a lot of people. There's no organization that is focused on raising money for these diseases or helping the people who are affected by them. So we turned to the community and we said, okay, what would you like to do? And a good handful of other patients in other states stepped forward, and we launched the foundation just 2.5 years ago. It's incorporated here in Massachusetts. And but we do what we can, but it's all based upon our volunteer effort. Everything we do is volunteer. And we do what we can to help patients and support researchers.
Okay, and you've raised quite a bit of money for a group that's only been in existence for 2.5 years. You've raised $250,000, I think I read somewhere.
Yeah, we did last year. We raised over $260,000. This year we're awarding $240,000 in research grants.
My goodness.
So we're very, very proud of what we're doing. We have our big event here in Massachusetts, actually in Burlington and Lexington, coming up the end of August. We'll be putting on a national conference with top experts flying in from the University of Michigan and Duke University to present what they're doing on research. We have stem cell researchers coming in. We have social group programs and activities. We have the Massachusetts Commissioner on Disabilities coming in to do a program. So a whole weekend stuff we're doing, and we're having a walkathon in Lexington in Lexington Center, and we hope to raise a lot of money.
And this is to coincide with the event, the conference
right,
that you're going
we'll be
on.
providing information, raising awareness, providing support, and hopefully raising a lot more money for research.
Okay, and so is that how you do most of your fundraising, through events like walkathons, or are there other?
Well, we're very young. We're just now into our 3rd year, and that is our primary method at this time. We also have a group in Maryland who are doing a golf tournament. We did a cookbook last year, and we raised some money by publishing a cookbook. So we turned our community and say, what can we do? And we hope that our community and their network and friends and family would like to help us, because we all want to see the cure. And we're told by researchers that cures for our disorders and similar disorders really are possible in this generation. It's really very exciting, the things that are going on in our diseases and Lou Gehrig's and spinal cord injury. They're all related, and we know that cures are going to be found.
Well, that sounds wonderful. Have you become involved with the foundation yourself at all, Joel? Or?
Yes, we've been involved with a support group, and Kathi, with her wonderful organizing and leadership skills, has gotten me and my wife and my entire family involved in the planning and fundraising for this walkathon.
Oh, terrific! That's terrific. So, now, and you say that it's all done by volunteers. That was another
absolutely 100%.
Because even something like a brochure here, you say this is all a volunteer effort.
Yep, we produced the materials. I wrote the materials. We had doctors review everything, and we had volunteers who did the design for it, who provided the printing for it, who provided the mail-out services for us, and even put the stamp on those envelopes to get those mailed out. So it's pretty unbelievable what people can do when they work together.
Oh, it sure is. Okay. Well, I know we're coming to the end of our time here together, and I just wondered if you had any last bits of advice for anyone who might be facing an uncertain time, either with symptoms like this or going through the testing diagnosis phase. Do you have anything that you would like to add, any words of encouragement? Or
I think Joel had a good one. We were talking before the show, so I'll leave that one up to you, Joel.
I think if you're developing unusual neurologic symptoms, you really need to find a good neurologist.
Okay.
And go through the testing led by the neurologist to find the truth.
Okay. That is a good bit of advice there. And also, I think to tap into your foundation here and to get the advice and support maybe of some people who have gone through
we're
this.
20,000 people. We're 500 or more with Joel's disease. We're about 20,000 or so with our disease. So there's a whole community out there who can help.
Okay. And with them, they know people, and that's how the word gets around and the network grows and all. Well, I want to thank you all both for being here today and for providing this insight and education for us about these diseases, because for many of us, we aren't aware of what's going on out there when it comes to this. And I want to wish you both well personally, and I want to wish your foundation success too in pursuing the events that are coming up and in future fundraising. So thank you again for joining me.
Thanks.
And I want to thank you as well for being here, and I hope you'll join us next time. Thank you.